Hey folks, I am here with Dr. Ray Cahill of SeaPort Veterinary Hospital. How are you, Ray?
I'm great, Kory. Good to see you, man.
Good to see you. Strange times, huh?
It's very strange, very strange.
So, what have you done at the veterinary hospital to adjust to the this pandemic?
So good question. A lot. So at the hospital, we've had to establish a series of protocols really aimed at doing what we can to protect our staff as best we can, because the more they're protected, the healthier we are, then the more services we can deliver to our patients.
Hmm.
As you'd imagine, our routine decontamination protocols were increased in that we're sanitizing everything with a lot greater frequency. Um, Utilizing what is known as personal protective equipment, so just basic gloves, gowns, even the face masks. There's the routine surgical face masks, along with other well-established isolation protocols, but for all patient contact. So for every single pet that we're coming in contact with, trying to protect ourselves, not carry stuff around, potentially pick something up off of a critter. And most significantly, we've shifted to a model of what we're calling curbside care. So, and I've heard through the grapevine, other hospitals across the country have gone to similar systems where we're not letting clients in the building, and that sounds so draconian, but it's a big deal. So clients arrive for their appointment with their pet, and we say, hey, when you get here, the door is going to be locked, so give us a call from the car. We're going to discuss the case with you over the phone. We're going to send a technician with the glove and the mask and the gown out to retrieve your pet, bring them into the hospital. Doctor will do the exam, get back to you on the phone with all their findings, recommendations. We can then follow up and do whatever treatments or diagnostics are indicated. We're not taking cash right now, so we're doing all transactions by credit card over the phone. And then we bring the pet right back to the vehicle. Pretty straightforward. It's been going great, thank goodness. Clients have been very kind about it and very appreciative. A lot of people are taking this quite seriously, so they really appreciate these measures. That's nice to see.
So, and have you had to do anything specific with the staff, like stagger hours or shifts or anything like that?
We haven't yet. In the building, again, we're being very conscious about our our space. The nature of our job is we're kind of on top of each other. You're right there with the animal. You're very close. So we're washing hands a ton. Again, wearing a lot of the personal protective equipment. Haven't had to stagger shifts. We're not at full staffing at the moment. This coronavirus has taken our staff down a pin. Nobody has coronavirus, I'll say that, but here at the hospital that we know of. But circumstances, people's home lives, living with people who might raise the level of concern, either young children or elderly family members. So we're not at complete capacity for our staff. We've had to scale back our elective surgical procedures quite significantly. But again, we're trying to really focus on mostly on the sick animals.
And so, and speaking of the sick animals, and here come the questions, right?
That's okay.
Yeah. Can animals contract the coronavirus? We know it started from an animal, but
Right.
so are you in danger handling these animals at all?
Right. So it's a great question. We get asked that a lot. And when it comes to pets or animals or even livestock, really, it's we don't deal with much livestock. But the a couple of key points. So the first thing is that there isn't any evidence that of human to human transmission, or I should say, sorry about that. There isn't any evidence of people picking up coronavirus by interacting with a pet. There are no documented cases of that. Some very smart people have been looking at that exact. They've been looking at this since the SARS epidemic, and looking at also with respect to COVID-19, trying to look at cats, dogs, ferrets, other animals to see if there is any way that a pattern of infection can be established and with those animals, and can those animals then become transmissible? Can they then pass it on to people? The answer so far is no. Nothing's been documented, proven. There's no cases of it. So that's a relief. But common sense measures, Kory, have to apply. You figure if somebody's got COVID-19 and they're snuggling the cat all day, we have to respect that, just like your iPhone can become a surface, contaminated surface, a doorknob. We have to respect that that there's the potential for the virus to, at least temporarily, have the potential to be on the pet, on the fur. So that's why we're taking the precautions we're taking here, especially with the masks and the gloves and the gowns. So again, the veterinary epidemiology world says we think the risk is extremely low. But again, the whole goal here is to flatten this curve and mitigate the risk as much as possible.
Gotcha. So is there anything else that you want people out there to know about, say, how you're dealing with this, or what your staff is doing, or just sort of assuage any fears about they're handling their pets?
If it's your pet, it's your household, and we assume that whatever's going on in a household is kind of probably being shared within the people in that household. As the more contained your household is, the better off you are. So interacting with other people, interacting with a neighbor's dog, or if you're out on a walk, might not be the time to squat down and let that dog smooch all over you and give it a big hug. We have warmer days coming, and why don't you save that for a month or two from now? We're what could I say, really, other than we're scared, we're nervous, but we take what we do seriously. We want to be here for people, and the more calm that can be out there in the world right now, I think the lower the stress levels, the healthier we're all going to be in the big picture. And we're here as a resource. So if there's any questions, we want people to reach out. We're trying to post, not too much, but we're trying to post very relevant, up-to-date stuff on our Facebook page. Twitter, there's some stuff out on our Instagram page as well. So we're trying to, again, be a beacon of relevant knowledge for folks.
Very cool. I appreciate your time, Ray. And if you're okay with it, maybe we can follow up again. I know, because it's such a fluid situation and things are changing on a dime here. Just how you're being proactive and reactive to what's going on around us.
Yeah, absolutely. That'd be great.
Okay, I'll be in touch. Thanks so much.
Good. Stay well, wash those hands, and we'll see you soon.
Take care.
Thanks, Kory. Cheers.